Welcome to the Weight Loss Surgery Information Session, sponsored by Beth Israel Deaconess Medical Center and Beth Israel Deaconess Hospital Milton. We're excited that you have chosen Beth Israel Deaconess to assist you in learning more about weight loss surgery and the options that might be right for you. You may have found yourself here because either you, a friend, or a family member has expressed interest in weight loss surgery. If you are here because you recognize that you can't do this alone, rest assured you will not have to. Here at Beth Israel Deaconess, we recognize the challenges you may have faced in the past or may still be enduring today. We promise to guide you through the progression of your weight loss journey and to provide you with support and encouragement when it gets challenging, and we'll challenge you when you feel like you can't do anymore. Our team of dedicated health professionals will be here for you each step of the way and for years to come. So welcome and congratulations on taking the first step towards better health. When you made the decision to visit our website to see what we were all about, you may have found yourself asking, why should I choose Beth Israel Deaconess for my weight loss journey? In 1999, Dr. George Blackburn started the Beth Israel Deaconess Medical Center's first weight loss surgery program. Dr. Blackburn dedicated his career to weight loss surgery and advancing the treatment of patients with obesity. His accomplishments include having performed New England's first gastric bypass in 1973 and initiating the Betsy Lehman Center for Patient Safety's inclusion of weight loss surgery. Thanks to Dr. Blackburn's efforts, in 2006, the Beth Israel Deaconess Medical Center's weight loss surgery program was the first in the country to receive the highest level of accreditation by the American College of Surgeons. We have a history of national recognition for commitment to safe patient outcomes. In 2012, Beth Israel Deaconess Milton joined the affiliation and was accredited in 2013 by the American College of Surgeons.
I'm Angela Fenton, Director of the Center for Specialty Care and Bariatric Surgery Program. I'm also a licensed mental health provider. As Stephanie has wonderfully described and highlighted our program history, I will be reviewing the personalized approach to weight loss surgery, as well as the patient-centered programs that our team has specially developed to ensure your long-term success. Every member of our multidisciplinary team has been specially trained in the field of bariatric surgery and includes surgeons, dietitians, bariatrician, licensed mental health providers, nurses, and administrative staff. We are all committed to patient safety, outcome, and long-term success. Our talented team also includes a select few extended partners, Jocelyn, Adrius, and our sleep lab, which is newly designed at BID Milton. Our team offers support and encouragement, both pre- and post-operatively, offering patient-centered programs that have been shaped with our patients' needs and long-term success in mind. These include monthly support groups, cooking demonstrations, and recipe and clothing swaps. We believe that our patients that attend these supportive programs will have long-term success and sustained weight loss. Our team is committed to seeing you when you are doing well, to celebrate your success, and even more importantly, when you need our assistance and direction to get back on track. Most importantly, we all love what we do. Our team is honored to be a part of your weight loss surgery journey and look forward to working with you as you improve your overall health and well-being.
Hi, I'm Daisy Mendez, one of the registered nurses with the Beth Israel Deaconess Milton Weight Loss Surgery Program. I'm going to introduce you to some of our program basics and criteria. If you are considering surgery for long-term weight loss, there are several requirements you must meet for both insurance approval and surgical approval prior to joining our program. The first requirement is that you must have a body mass index equal to or greater than 40. If you have a body mass index between 35 and 40, you may still be a candidate if you have other medical issues or health concerns that are considered to be comorbidities. Examples of these comorbidities include obstructive sleep apnea and diabetes. If your body mass index falls in the 35 to 40 range, our team will help you determine eligibility. If you are not sure of what your body mass index is, you can look up how to calculate it online, or you can call your primary care office and ask for it. it is important that you use an up-to-date recent measurement of your weight and your height. If your current body mass index qualifies you, the next requirement we ask for is whether you have had a minimum of 2 previously failed formalized diet attempts. Examples of these include medical weight loss, pharmacotherapy, or structured commercial diets. We look for both duration and effectiveness when we review these attempts. Here at Beth Israel Deaconess Milton, as well as Beth Israel Deaconess Medical Center in Boston, we operate only on individuals who are between the ages of 18 and 69. If you are 70 years of age or older, you are still eligible to screen, but your case will be reviewed by our medical director before any appointments will be scheduled. The ability to move forward is determined on an individual basis. For some individuals, you may meet all of the requirements, but still be unable to move forward with bariatric surgery due to previous or current health-related issues. It is important that you are considered to be an acceptable operative risk, meaning that we would not put you at risk of harm by moving forward with an operation. Your operative risk is assessed by our bariatrician. If you are found to be an unacceptable operative risk, the reasoning behind that decision will be discussed with you at length. Another one of the requirements that we have in place for patient safety is that you have a mental health evaluation with one of our licensed mental health providers. These requirements will be further outlined later in this video. You will receive a call from a staff member to schedule your next visits with our clinical team. Team members you can expect to meet include our medical director, our mental health professionals, our dietitians, and our registered nurses. There are a series of visits that will be required of you. Please take this time commitment into consideration when you are thinking about bariatric surgery. During your visits with our team members, you can expect to have various tests and labs ordered on your behalf. These tests will help us to further assess your candidacy for surgery. If any of the ordered tests return abnormal, we may need to work with you and/or another healthcare professional before proceeding with your surgical screening. Once you have seen all of our team members and have been cleared, you will be scheduled to meet with your surgeon. At your surgical visit, you will decide which procedure you are having and offer the option to ask any questions that you may have. Lastly, at the end of the visit, you will sign consent for surgery. Before you move forward with your surgery, it is important to discuss this decision with your primary care provider to determine if it is the best, most appropriate option for you and your overall health. If you and your primary care provider agree with the decision to move forward with bariatric surgery, be sure to discuss the need to change medications with them as well as your pharmacist prior to surgery. After surgery, all medications must be in crushed, liquid, or chewable form. You will no longer be able to take extended release medications. If you are on oral contraceptives, you will need to stop at around surgery date, which will be discussed further with your surgeon. If you are on biologics, you will need to stop preoperatively. If what I said confuses you, do not worry. This subject will be reviewed with you again. One of the most important things you can do, and that we will hold you accountable for, is preparing yourself for the lifestyle changes and commitments that will be expected of you after surgery. Examples of these changes include healthy eating, maintaining weight loss, portion control, exercise, and more. You will receive a bariatric surgery workbook. The workbook will outline all of the above-mentioned responsibilities and requirements. It will also contain a detailed outline of the diets we will implement. Please be sure to review this workbook thoroughly. After surgery, there will be things you used to do that you can no longer do. Examples include drinking carbonated beverages, using straws, and chewing gum. These things can cause the stomach to be filled with air, which competes with food. There could be a lot of air in the stomach that you cannot expel since the stomach structure has changed. So, in turn, you end up with abdominal pain and discomfort. You will need to limit caffeine post-surgery as it can cause dehydration and worsen reflux. Consumption of alcohol post-weight loss surgery is on a very infrequent basis. It can cause weight gain, ulcers, and put you at a higher risk of developing alcohol problems after weight loss surgery. Both smoking and NSAIDs, like aspirin and ibuprofen, can cause ulcers, bleeding, and perforation requiring hospitalization and surgery. Women taking estrogen must stop due to the potential risk of blood clots post-surgery. We ask that you check with your GYN prior to surgery. We ask that women of childbearing age not to get pregnant until they are at least 2 years post-surgery due to risk of complications from rapid weight loss, and it can derail weight loss surgery progress. We also ask that you abstain from recreational drug use. All of the information I have just provided is available in the workbook you will receive. Along with what I have shared, there will be more information as well. It is critical to your success that you understand and agree with all of the changes we are going to ask or require of you. While currently the most effective long-term weight loss option, bariatric surgery is only a tool. If you do not work hard and follow the suggestions of our team, your success will vary. We want what is best for you, and we want you to achieve as much success as possible. So be sure you are willing to accept these commitments before proceeding with bariatric surgery.
I'm Dr. Dan Jones, Chief of the Division of Minimally Invasive and Bariatric Surgery. I'm going to talk to you today about weight loss surgery. Before landing on this page, searching for surgical options for weight loss, you have probably tried many alternatives. You're not alone. 1 in 3 adults are overweight or obese. Being overweight increases the risk of developing diabetes, high blood pressure, heart disease, stroke, and many other health problems. Losing weight not only decreases these risks, but it can help you get rid of certain ailments entirely. To qualify for weight loss surgery, you must have a BMI greater than 40 or a BMI greater than 35 with weight-related illnesses. These weight-related problems include such things as obstructive sleep apnea and diabetes. If you are unsure about what your body mass index is, no worries, just go online and look it up, or you can ask any of the members of our team to help you figure it out. The benefits of weight loss surgery may include improving or resolving weight-related issues, discontinuing or decreasing the doses of some of your medications, enhancing your mobility, and most importantly, improving the quality of your overall life. For patients more than 100 pounds overweight, the National Institute of Health recognizes weight loss surgery as the most durable form of weight loss. As you meet the members of our multidisciplinary team, you will learn much more about your own health and what you might expect to gain from weight loss surgery. The most popular weight operation we're doing today is a sleeve gastrectomy. In that operation, we take a big stomach and we shrink it down to a smaller stomach, basically the size of a cantaloupe brought down to the size of a banana. You eat smaller meals, and with smaller meals, over time you lose weight, assuming that the choices you're making are good choices. And one of the tricks to how it works is by making a smaller stomach, when the stomach is actually empty, there's less signals to the brain saying, hey, I'm hungry, eat more. So it makes it easier to get through the day. We're seeing some good results with the sleeve gastrectomy, and as you come through our program, we'll tell you more about the risks, benefits, and alternatives to the sleeve gastrectomy. One of the most frequent questions we get from patients is, how long does the operation take, and when can I get back to regular activities after the sleeve gastrectomy? For some patients, the operation can be as little as an hour. In terms of recuperating, many patients can go home from the hospital the next day. Of course, if you need more time, we're there to support you, but if you're ready to go back, we don't hold you back. There are some things that patients can do to help get themselves ready for surgery. Eating more healthy, exercising, and kind of cutting out some of the desserts in bigger portions. The better you're prepared to start your operation, the more likely you're going to get through it and get a better result. None of the weight loss operations are without risks. Infection, bleeding, clots in the legs that go to the lungs, these are all things you're going to learn more about as you make the decision of trying to weigh the potential benefits from the potential risk. The average patient takes 2 to 3 years from the time they think about having a weight loss surgery to the time they actually decide to have it. The process seems like it takes forever. We're going to be as careful as we can looking at your health-related problems and making sure that you're ready from the health point of view as well as the psychological point of view to having a weight loss operation. For many patients, weight loss surgery is a transformative experience. Our multidisciplinary team is here to help you through each of the steps of the process.
My name is Suhail Adra. I'm the Chief of the Bariatric Program at BID Milton. I'm going to talk to you about the bypass procedure, the Roux-en-Y gastric bypass. The way we do the procedure is a small pouch of stomach that is divided from the rest of the stomach. It's connected to your esophagus, so food goes down to the esophagus into that small piece of stomach that will provide some restrictions, so your amount of food that you can have in there is tiny, and it's about the size of an egg. Then we connect that stomach to a piece of the intestine, and that will allow for the drainage to happen. Then downstream from that, we reconnect the small intestine to connect together and to allow for the drainage of the digestive enzymes, which are essential for the digestion and absorption of the food. Doing that, you just have the food go into the esophagus, the small pouch of stomach, and the small intestine without going to the larger stomach. So that's why it's called the gastric bypass. You're bypassing that stomach, but you're also bypassing a small piece of the small intestine that's attached to the stomach that we call the duodenum. This is where about 60 to 70% of all of your calories and all of the nutrients are absorbed. So that actually is a double-edged sword, because not only do you not absorb the calories, but you could potentially get malabsorption down the line, which is one of the complications that we worry about with the bypass. So if that's happening, we want to make sure that our patients maintain to prevent long-term complications of vitamin deficiencies, protein malabsorption. So the patients have to be really careful with making sure to maintain their protein intake, maintain vitamin intake over the rest of their lives. One of the complications of the bypass is ulcers. Ulcers are essentially something we worry about, specifically in patients that would be smoking, taking anti-inflammatory medications like ibuprofen, Aleve, naproxen, or others. And the other thing that could cause that is alcohol. So we recommend all our patients that are going to get the bypass to avoid those for good. Another one of the complications that can happen with ulcers is also pain, bleeding, and causing a hole in the stomach at the connection between the stomach and the small intestine, what we call a perforation. This will require another procedure to fix that. Other complications with surgery that we worry about with weight loss surgery is DVTs, which is deep vein clots that could potentially go to your lungs. Those are could be serious, and we prevent them by making sure that all our patients walk the day of the procedure, that they stay active, and that they stay hydrated. We also give some medications to prevent the clots from forming, and we put some sequential compression devices, which are squeezers on your calves that will allow the massaging of the muscles to keep the blood flowing in your legs. Other complications of the bypass is a leakage that could happen at the connection between the small intestine and the stomach. This happens in less than 0.4% of cases. During surgery, there's multiple ways we can actually check that there's no problem at that connection, and we test it right there and then to prevent that from happening. Still, there is a small chance of that happening. Other complications is an internal hernia. An internal hernia can happen in about 0.7% of all patients. This is a lifetime risk. So what that is basically one of the loops, remember we were moving those intestines and moving them around, actually creates potential spaces. We close those spaces during the time of surgery, but still sometimes when somebody loses 100, 150 pounds, those get bigger over time. And then you may get a piece of intestine that can lodge behind that and cause a potential obstruction of that loop of intestine. To summarize then, the bypass is the procedure that has been done the longest of all other procedures. It provides about 75% of the excess weight to be lost. It's performed laparoscopic. We also perform it robotically. In some cases, when patients have had prior multiple surgeries, an open procedure may be needed. The amount of time that you spend in the hospital is about 1 to 2 days. The bypass is a procedure that's very effective. and it has a very long track record of weight loss that is the most tested among all other procedures.
Hello, I'm Dr. Rahul Gupta. I'm an attending surgeon in minimally invasive surgery and bariatrics. I am going to talk about gastric band today. The first laparoscopic band was placed in 1993. The US clinical studies were done in late 90s, and FDA approved the gastric band in 2001. The gastric band took off rapidly. In late 2000, it was one of the most common procedures done in the United States. Gastric band is a silicone band which is wrapped around the upper part of the stomach. It creates a small pouch which is the size of the golf ball. It restricts the amount of food a person takes, and the feedback from the upper part of the stomach gives to the brain and reduces the overall hunger effect. The band in the inner part has a chamber which is filled with saline. It is connected to a port which is placed in the upper part of the abdomen. Through this port, the gastric surgeon can reduce the saline or increase the saline and therefore control the aperture of the gastric band itself. The procedure is done laparoscopically. The patient does have to be under general anesthesia. 5 incisions are given and the band is placed around the stomach. It is connected with a tubing to a port which is placed in the abdomen. As any surgical procedure, the band has its own set of risks. The risk of surgery are the band can get malpositioned where it causes an obstruction. Part of the stomach can slip behind or in front of the band, causing the stoma of the band to get obstructed. As any foreign body, it can get infected, either the port or the band itself. And the band with time sometimes can erode into the stomach wall to essentially lie inside the stomach rather than outside the stomach. Overall, the advantages of a gastric band is it's a least invasive procedure. It is easily reversible, and patient is in total control, both with regards to the amount of restriction and the pace of weight control. The disadvantages of the gastric band are that it is not as good as other weight loss procedures. It does not work for high caloric liquids, and one of the major disadvantages which led the band from being the most common procedure to being not as common today is the level of revisional surgeries. It is estimated that 40 to 50% of the patient would require some kind of revisional surgery, whether removal, replacement, or conversion to another weight loss procedure. In summary, the gastric band is an FDA-approved procedure. It has its own set of risks and benefits. For a select group of patients, it could be the treatment of choice for weight loss. Whichever procedure is right for you, our team is here to support you through your weight loss journey.
Hi, I'm Dr. Morgan Bresnik, bariatric and minimally invasive surgeon. Revisional bariatric surgery refers to anyone who has previously undergone a weight loss surgical procedure and is now looking to revise or change that procedure. The most common revision surgery that we perform is for patients who have previously undergone an adjustable gastric band placement and who have had either problems with the band, such as reflux or inadequate weight loss. In this case, we remove the band and convert later on to a sleeve or bypass procedure. Oftentimes, we do this as a two-step procedure, first removing the band and then allowing some time for the scar tissue that forms around the band to lessen before later returning for that conversion surgery. During that time, patients will work through our program, meeting with members of our multidisciplinary team in preparation for their revision surgery. Patients who undergo revision to sleeve or bypass can be expected to lose similar amounts of weight to other patients undergoing those surgeries as a primary procedure. For patients who have already undergone either sleeve or bypass in the past and have had problems with weight regain or other complications, there may be revision options available for them too. This may include making the sleeve smaller, converting from the sleeve to a bypass, or making the stomach pouch of a gastric bypass smaller. There are other procedures that are less common, and those may also be revised. Revision surgeries are determined on a case-by-case basis in consultation with a surgeon. The risks of revision surgeries are slightly higher than those with primary surgery and will be discussed on an individual basis depending upon your history. In some cases, revision surgeries may be done laparoscopically or robotically assisted, as with a primary surgery, or with a larger incision due to the degree of scarring from a previous procedure. There may also be the options of endoscopic revision, or a procedure done through a flexible camera inserted through the mouth and into the stomach. This avoids altogether the need for additional incisions. Again, all revisions are determined individually based on your individual history. If you are found to be a candidate for revision surgery, you will still need to meet with all members of our multidisciplinary team before undergoing the procedure.
Hi, I'm Danelle, one of the dietitians who will be guiding you in this journey. During your individual visits, we will be working on making positive lifestyle changes that will help promote long-term success with weight loss surgery. However, you don't have to wait to see us to start making changes. We like to see that you've already decided to get started, whether it be using some of the ideas in the workbook, initiating regular exercise, or making healthy food choices. Today I'm going to jump into the future to share with you some general nutrition guidelines for the 2 weeks before surgery, introduce you to our diet stages, and provide information onto some other nutrition considerations. For the 2 weeks before surgery, we have you following a very specific diet, serving as one final push towards weight loss before surgery, which in turn will help to shrink the liver, making the surgery safer for you. This diet will consist of 3 meal replacements and 1 meal daily. The meal replacements will be further detailed when we meet at your first appointment, but as an example, a meal replacement during this time could be a bar or a shake. Either option should contain about 200 calories and 15 to 20 grams of protein each. This is a good time to try different protein shakes, different brands, different flavors, as you will be heavily relying on these after surgery. Your daily real food meal will consist of 1 food from each of the sections of the food chart in your workbook. Each food has a specific portion size in which a food scale, measuring cups, or measuring spoons will be of benefit to you. Or, instead of all of these foods, you may opt for the substitute, which is a well-balanced meat and vegetable-based frozen entree. To coincide with your daily meal, please see the lists of foods that are also allowed, the foods that are limited to no more than 3 times per day, and the list of foods that may be eaten in any amount. What I have just outlined will be your life during the 2 weeks before surgery, right up until the day before. To make sure your stomach is indeed empty to be operated on, we ask you eat your real food meal for either breakfast or lunch, and then liquid meal replacements until 7 p.m. After 7 p.m., please consume only clear liquids, and after midnight, you are to be NPO, or nothing by mouth.
Hi, I'm Michelle, another one of the dietitians in the program. While Danelle talked about the specific nutrition information before surgery, I'll now introduce you to our diet stages. Once you are out of the OR and on the hospital floor, you'll be getting started on the stages. These stages are designed for a purpose, as you will be relearning not only what you're eating and drinking, but also how you're eating and drinking. The stages and timing are important and in place to make sure that you are healing and to ensure tolerance. To avoid complications, it's important that you do not self-advance your diet. Lastly, please understand that everyone will move at a different pace and progression may vary per person. Stage 1 is simply clear liquids, things like sips of water, sugar-free drinks, or broth. This stage will last 1 day or less, is fully completed in the hospital, and is in place to stimulate digestive function and to make sure you're comfortable and tolerating fluids. Once you've demonstrated tolerance to stage 1, you will progress to stage 2. This stage will be started in the hospital, and once you're tolerating the stage and otherwise ready for discharge, you will be sent home to continue. You will remain on this stage until you come back to the clinic and advance your diet with your dietitian. It will be important to taste test these foods prior to the surgery and to make sure you've tried several different protein shakes, as your preferences may change and it will still be important to get in this nutrition. Stages 3 and 4 move you closer to returning back to your normal eating pattern. At each visit with your dietitian, you will be assessed for tolerance regarding the previous stage and progressed as indicated.
Other than following the diet stages, we have 3 nutrition goals for you to achieve each day as you recover after surgery. Goal number 1 is the most important, and that is staying hydrated. We ask that you drink between 2 to 4 liters each day, or 64 to 128 fluid ounces. While this may sound easily attainable now, after surgery, getting this much fluid in will take you nearly the entire day, as you cannot drink quickly and you cannot utilize straws. Your fluids will need to be non-carbonated. Bubbles are extra air that can cause discomfort and can put pressure on the surgical sutures and can possibly stretch your new pouch. We ask that you also avoid caffeine for 2 months after surgery, as caffeine is a diuretic that will dehydrate you when you're working very hard to stay hydrated. Even decaf coffee has a little caffeine in it, and besides that, coffee is very acidic, which will irritate the inside of your new stomach. The second goal is a protein goal. After surgery, weight is typically lost quite quickly, and muscle mass is also lost. We want to preserve your lean muscle mass to keep you strong and make sure you are healing after surgery. Your protein goal each day is 60 to 80 grams of protein. The last goal is to nourish and heal. Given your intake will be significantly decreased, you can expect to feel tired. However, this will improve over time, as will your ability to tolerate an increased amount of fluids and food. Even if you are tired, not hungry, or not thirsty, getting in this nutrition is critical and your top priority.
Aside from taking in nutrition from fluids and food, you will need to take a regimen of vitamins and minerals for the rest of your life. With all the procedures being restrictive in nature and taking the malabsorptive effects from the gastric bypass into consideration, you will be at higher risk for developing micronutrient deficiencies. These deficiencies can be irreversible and can affect your quality of life. During the screening process, your dietitian will be getting you started on at least a complete multivitamin daily, and any other supplements will be based off of your labs and medical history. After surgery, the multivitamin will need to be in chewable form, not a gummy multivitamin, as these are lacking in important minerals. All other vitamins after surgery will also need to be in a chewable, crushable, or liquid form.
Hello, my name is Leanne Burke. I am a nurse practitioner on the inpatient side at Beth Israel Deaconess Medical Center. I'm going to tell you about a new surgical pathway that we have put in place to improve your recovery process during your time with us after surgery. The Enhanced Recovery After Surgery, or ERAS pathway, is a multi-team approach to patient care taken to improve a patient's entire surgical experience. The purpose of the ERAS pathway is to decrease the amount of stress placed upon the body after having a surgical procedure. On the ERAS pathway, patients are able to drink clear liquids up until 2 hours prior to surgery, given alternative types of anesthesia, and have their pain managed with non-opioid containing medications. Research shows that patients who follow an ERAS protocol during their surgical journey have a reduced number of complications from surgery, go home from the hospital earlier, and have fewer unplanned return trips to the hospital. Our Weight Loss Surgery Center is committed to providing excellent care to our patients, and we believe that the ERAS pathway is an important step to reach this goal.
Our program utilizes ASMBS, American Society of Metabolic and Bariatric Surgery guidelines to determine psychological clearance for surgery. Each and every patient's well-being and safety is our #1 priority. Every patient receives a psychological assessment from a licensed mental health provider. This is not only an insurance requirement, but a program requirement to ensure that each and every patient is stable from a psychological perspective prior to surgery. The components of the psychological assessment include a review of weight history, eating patterns and current behaviors with regard to triggers for overeating, mental health history, trauma history, and presenting mental health symptoms are assessed with regard to impact on your safety and overall mental health stability postoperatively. Our mental health providers will assess substance abuse history and current substance use, abuse, and dependence. This assessment includes the review of the following: all drugs, alcohol, and cigarettes. Additionally, our providers will assess the following with regard to expectations for surgery, timing, and social support. Our team will ensure that based on presenting stressors or major life events, that the timing for surgery is appropriate for long-term success. Support is also an essential component of your success. Our team is here to support you, celebrate the quality of life changes, and provide encouragement and direction when you are faced with a challenge. We also need to ensure that you have a supportive home environment. We encourage a friend, family member, or significant other to view this webinar, attend a support group, or an appointment so that they have an understanding of the program and your journey. Based on our program criteria and ASMBS guidelines, the team may determine that it is not safe for you to proceed to surgery, or that it is essential that you receive psychological treatment to address presenting or unmanaged symptoms. If you present with unmanaged or untreated blood pressure, we would need to ensure that this medical condition was treated, and thus your mental health will be treated in the same fashion. All patients must adhere to the program determination before moving forward. This is for your safety and long-term success and well-being. We want each and every patient to achieve the full benefits of improved health and quality of life postoperatively. We look forward to meeting with each and every patient while we provide support throughout their weight loss surgery journey.
If you like what you have seen so far, here is what you can do next to begin your journey with Beth Israel Deaconess Medical Center and Beth Israel Deaconess Milton. The very first step in becoming a patient is to call your insurance company. The telephone number can be found on the back of your insurance card. It is essential that you verify coverage for bariatric surgery. Be sure to include your specific plan type, either HMO, PPO, or some other variation, to avoid confusion. Once you have verified coverage under your specific insurance policy, we ask that you request a referral to our clinic from your primary care provider. If a referral is not received prior to your visit, you run the risk of receiving a bill for services rendered. If a referral is not received prior to your surgery, you run the risk of being billed for that surgery. This step is very important. It is also important for both insurance coverage and your personal success with our program to have had at least 2 formal attempts at weight loss, including any of the following: commercial diet programs, prescription diet medications, liquid diets, herbal and non-prescription remedies, medical and healthcare treatments, therapy, or self-initiated attempts. With a referral in hand or on the way, you can call your preferred weight loss surgery location and we will provide you with the next steps.